and welcome to Boomer Health at Home. I'm your host, Maggie Jess, and on today's episode, Home Healthcare, A Legacy of Caring, we are joined by an expert in the home healthcare business services, Greg Jamian. He is a very well-known figure in the home healthcare industry. Hi, Greg. Welcome to the show.
Hi, Maggie. Thanks for having me. I guess the definition of an expert is someone that's been around too long.
Well, we really appreciate your insight in the home healthcare industry and kind of what's going on in Michigan today. So tell me, Greg, where did you grow up?
Well, actually, I grew up in this area, Birmingham. I went to Groves High School, graduated from Groves High School, and then we later, I got married, went to college, Oakland University, and then got married and moved out to Bloomfield Hills, and so I currently live in the township here.
Oh, okay, wonderful. So when we say expert, like you said, you're very well known in this area. So how long have you been in the home healthcare business?
Maggie, I've been in the business for 40 years, and I say that, and I just can't believe it, where that time went. But so much has changed in healthcare and in general, but specifically in the home healthcare business. We're seeing a huge increase in demand for the services and products that we provide.
Okay. What is the name of the company and what is your role?
So the name of the company is AmeriCare Medical, but
Okay.
AmeriCare is like the parent company. And we own Sun Medical Equipment Company, which was the first company that we started. And then we also own AmeriStaff Home Nursing Services, which is a traditional home care company, private duty. And then we have a pharmacy called RXIV that is a specialized pharmacy. And then we have a couple other smaller companies. But we also have a company that is brand new. It's called QCN, and we are going to be providing a lot of Medicare home health care services as well.
Oh, wow. That's great. It seems like you have your hand in every little aspect of home health care.
Well, we do, and I'm the president CEO of the company. And one of the advantages that we have is that we provide comprehensive services. There's a lot of companies out there that will provide, for example, just nursing or just medical equipment or just pharmacy, but we provide everything. So really, I don't want to sound cliche-ish, but one call does it all. So and our nurses and our staff can totally handle the comprehensive needs of pretty much most patients that are being discharged from a hospital or require post-acute services and in the home care setting.
Okay, that's a great slogan. You should tell your marketing guy about that. So I understand that you've done a lot with public service. You've served a lot in the public service arena, especially in Michigan. Can you tell us a little bit more about that?
Sure. I was, in business, started the business with a good friend of mine, Greg Jamian, who has since retired. But I was in the insurance business and healthcare specifically, and I saw where healthcare was going, and the hospitals were discharging patients quicker and sicker, and so we were able to provide medical equipment in the home, and that is how we got started into the business.
Okay, wow. So you had said earlier that...
But to answer your question, I'm sorry, I don't think I answered it. As I'm building this company, I felt a greater need to give back to the community. So some guys buy, an Italian sports car and, keep it in their garage. I decided to do something crazy, but it wasn't so crazy, and go into politics. And these were all part-time positions, so I could still perform my duties at work. But I actually ran and won a position in the Board of Commissioners for Oakland County, so I did that for 2 terms. I then, right here in the township, I was a township trustee on the board and did that for a while. And then I later went to the Road Commission, where I was a road commissioner for 12 years. And this is all while I'm working full time. And then, Oakland University, I sit on the board of directors of the School of Nursing. I've been doing that for quite a few years. So, but here's what I get out of it. It's the payback to the community, and most of these positions were voluntary, non-paying positions. So I felt really good about, public policy, trying to have an impact on it, and it's really helped me in my career. But I hope that I help people along the way, with the public service piece that I participated in.
Yeah. As an Oakland County resident my whole life and a graduate of Oakland University, I thank you for your services. You had an impact on my life and I didn't even know it, so thank you.
You're welcome.
So also new is a home health care center that's open on Woodward Avenue.
Yeah, that's a really exciting new development for us, and we felt that there was a need for a place to shop for medical equipment and supplies, things like orthotics, knee braces, ankle braces. As the over 55 age group people become more active, they're more active than they were, say, for example, 20 years ago. That there's sport injuries. We carry wheelchairs. We carry wound care supplies, blood pressure kits, walkers with wheels, all kinds of oxygen equipment, CPAP. So, but people can come in there and shop, and we're quite a bit more comprehensive than, for example, what you would see at a Walmart or CVS. I mean, we go in depth with a wider range of products and a deeper selection of products. And we're right on Woodward Avenue in Birmingham, and you can't miss our store. It's right next to Papa Joe's. So I invite anybody that's watching to stop by there one day. It's easy in, easy out, and it's really a cheerful place to buy equipment and supplies that sometimes not so cheerful to.
But you can get all your questions answered there as well.
Absolutely. We have professionals there that work there, some nurses. We have a conference room there. We call it our Woodward room, and they can sit and talk with the professional confidentially.
Oh, that's wonderful. That's
And
very
we can
nice.
arrange nursing care there. It's a home health care center. It's not just a store. It's a home health care center, and that's an important distinction, because somebody can come in with a myriad of different questions or needs and get the help they need.
Kind of going back to AmeriCare Medical having everything under one umbrella. You guys have that access for your Woodward store as well then?
Yeah, exactly.
Okay, that's great. So you had mentioned aging population, and we're moving more and more, being more active. Seniors are way more active than what I remember as my grandmother's generation. When I became a nurse, I'd say about 13 years ago, there was always this talk about a nursing shortage. You still believe that that is true today with our aging population?
Well, first of all, 10,000 seniors are, I should say, baby boomers are coming of age daily in the United States, 10,000 a day. Probably means hitting age 65. So the population bubble, it's this big bubble, looks pregnant. Sorry about that analogy, but by the way, congratulations.
Thank you.
And it's a large cohort that's moving into senior years. Okay, I like to say the more senior active years, but and so the demand for nurses and nursing care and medical is really skyrocketing. Now, there is a shortage of nurses, and being on the board of the Oakland University School of Nursing, we're trying to produce as many nurses, educate, train as many, and graduate as many nurses as we can. There is somewhat of a waiting list, but it's not too long, and I would encourage anybody out there that has a propensity towards healthcare or medical to really pursue a great career in nursing. Now there's caregivers. That's a bigger problem, because these are the people that under the nurses that we use in homes to help people, companionship, daily help with their aids to daily living, and those people are short in supply, and they're wonderful people that do a great job, and we need so many more of them, and there's an extreme shortage there as well. But our company is one of the few companies in the area. We have recruiting teams that go out and recruit these people. So when many other companies don't have staff available, you'll call them up, hey, I need a nurse or a caregiver. We always have nurses and caregivers to go out and help people with their home care needs.
Great. So you are seeing a decline in some aides and nurses amongst home health care agencies around the area.
Yeah, and it's a problem around the country as well.
Would you say the pandemic had something to do with that?
Oh, I think it had a lot to do with it, because a lot of mothers were keeping their kids were staying home from school, right? Mm-hmm. So the mothers had to stay home with the children. So that took a lot of people out of the workforce. And people are still somewhat, I mean, there is a percentage of people that are still uptight about going back to work. Mm-hmm. And so as things kind of ease regarding the pandemic, we're starting to slowly see a trickle of more employees coming in, recruiting more candidates that want to go back to work.
Nice. So light at the end of the tunnel, as they say. Okay. So you'd mentioned earlier that AmeriCare is expanding its services to Medicare, and that you currently have a private duty agency. What are the differences for those watching in those two sectors?
Sure, and that's a common question. So private duty allows a patient or a client or a family to hire nursing or caregivers to provide the necessary home services 4 hours, 6 hours, 8 hours, 12 hours, 24 hours. And so the caregiver or nurse would actually be in the home for that long of a period. Now, the reason you need that is to help with meals, bathing, getting dressed, and being attentive, for longer periods of time. And many people need that, especially if they're in bed and they can't get out of bed and that sort of thing. Whereas the Medicare certified nursing piece, which we are now doing, is a nurse that comes out to the home. She spends an hour, 2 hours with the patient, usually an hour, and it's more of an educational visit. It's more, they'll help arrange your medications for you. It's they'll maybe change a dressing, once you post-acute from a hospital. So it's only, they're in and out, okay, whereas the private duty, stays for a longer period of time. Now, private duty you have to pay out of your pocket for, and whereas the Medicare certified, Medicare will pay for it, so you don't have to pay for it. But you're only talking, an hour a day, 3 days a week for maybe 2 weeks, and then the benefit is done until the next episode or your doctor renews the order. So it doesn't solve the problem of long-term needs or care, but it's certainly beneficial for people that are new to needing a little help around the house. Mm-hmm. And Medicare does pay for it.
Okay.
with no out-of-pocket for the person usually.
Would you say in the
beneficiary.
sense Medicare is kind of like a medical necessity and private duty is kind of catered to that specific individual, what their needs are at that time?
You could say that, but there's a lot of people that cannot be without a caregiver. And that's becoming, as people age longer and longer, older and older. I mean, it's nothing now for people to live to 90, 92, 95. And hopefully a lot of them are healthy and able to walk and talk, right, as they say. But many of them need the round-the-clock care. So your choices are hire a private duty nurse or go into assisted care or a nursing home. And many people, especially in this community, would prefer to pay to have their loved one home rather than put into a facility.
Yeah. You're most comfortable in your own home.
Yes, absolutely.
You heal better in your own home. Absolutely. I've noticed that as a
And
nurse.
you heal better, you rehabilitate quicker, your pets, your family members. During COVID, a lot of the assisted care facilities were locked down, so family members couldn't even go and see their loved ones. Whereas the people that had home care through us, private duty, they could have any visitors they wanted because, they were in control. They could monitor who was coming in, who was coming out. They could monitor the caregivers as well. So it put the families in control versus the facilities in control. It was a huge difference, made a huge difference.
You're talking mostly about autonomy, and I think that's a big thing in healthcare, and sometimes we lose
Maintaining
scope.
your independence,
Yeah.
and that's what we're all about. We're here, we do what we do, and there's many companies like us, home care companies, that their main goal is to keep the patient, especially in the senior years, independent.
And feeling good about
Yeah.
themselves. That's great. So what kind of service areas are we looking at? Are you just in the Birmingham, Bloomfield, Franklin, areas? Just in Oakland County? Do you expand out?
So, our focus is in this general area, but we service, for the private duty, it's the communities you name, maybe Farmington, West Bloomfield, it's Novi, Troy, Rochester. But we actually have nurses in servicing southeastern Michigan. So we've gone out to Ann Arbor, we've gone up to into Livingston County, Genesee County, especially with equipment, supplies, and pharmacy services.
Wow, okay. So pretty much you try to make it work.
Yeah, we do.
Okay,
We're
that's
all about
great.
taking care of the customer.
Okay. So we've been talking a lot about, how to transition into the home and things like that. So how does AmeriCare and or home care company rely or look to hospitals? What's the hospital's role in all of this with home care?
So, we're in 8 hospitals. We have offices and staff that helps with discharges in 8 hospitals. And there's such a shortage of companies, of employees out there that would work for companies like ours, that these hospitals need to discharge these patients quickly. And because they get penalized if they keep the patient in the hospital too long. So we help assist them with that discharging process, and we bring the patients home, so to speak. And we take care of them while in that transition. We help with that transition in care. And we do work closely with many hospitals. And let's face it, a lot of people go in for hip surgery or cardiac rehab or possibly a stroke, and they're hospitalized and then they're discharged. So, we have great hospitals in this area in our community, and so having a close relationships with the hospitals is really important to the mission of AmeriCare and the companies we own and operate.
Wow, that's great. It sounds like you guys are a very trusted home health care community And to have 8 hospitals, to rely on you for that is very, as someone who may seek that down the line for their parents or even myself if something happens and you need home care, being trusted within the community is a big concern.
So, first of all, as the CEO of the company, I am invested in this community. I am homegrown in this community. And, we're not a franchise. And we're not a national company run from, New York or California. We are a local company. We know the local market. I know the local doctors. I know the local hospitals. I know the local nurses. I know the local universities. I'm on the boards. So, the trust factor is a big thing, Maggie. I will tell you. And if we were ever to lose the trust of our community, we would have a difficult time. And that's one of the things that I think these franchises and larger companies have issues with when they come into a community, especially like Birmingham, Bloomfield, Beverly Hills, Bingham Farms.
Kind of goes hand in hand with confidentiality as well.
Well, confidentiality, we have some high-profile patients through our private duty company, AmeriStaff Nursing Services, and what goes on in the home stays in the home. It's like what goes on in Vegas stays in Vegas, so confidentiality is very important. In fact, we have confidentiality courses that we operate in our offices with new employees that where confidentiality is a real important thing. But we just started a new company called Private Reserve Home Care. And Private Reserve is 2-3 steps up from our already great service, but it's a concierge service for people that want that extra level of confidentiality, security, service, and it's a real popular option now.
Wow, so kind of like white glove service?
It is.
Okay, wow. Going back to being trusted and confidentiality and things like that, do you ever get the question of, are you bonded, are you insured? Why is that important to you if you are?
Well, finding employees, good employees, is difficult. It's not easy. And then once you find good ones, you got to do background checks on them. And we probably do more background checks than any of our competitors to make sure our people are squeaky clean when they go into somebody's home, and they're going to be in somebody's home for a period of time. So the bonding and insurance is something that in the event that we miss something, which never happens, knock on wood, never happens, then we have, our employees are insured and bonded. So beyond our company, there's the depth of these large insurance companies that take on the risk.
It must be hard to accept strangers into your home at times. So what kind of vetting process do you do with your employees?
Well, so you're talking about the selection process, and we go through many, many resumes before we pick 2 or 3 to schedule for interviews. We require in-office, in-person interviews. Most of our competitors will interview off the internet. And we think that, during COVID, maybe that was one option, but it's not a great option for the customer. For the customer to have somebody that's been vetted over the internet, okay? We like to see them, hear them, smell them. I was going to say touch them, but we don't touch. When you're meeting somebody and you're face-to-face with them, and our interviewers and our recruiters are talking to people one-on-one, we see a lot of things that you can't see in the synthetic atmosphere, of a camera.
Wow. That's great. I mean, you go the extra mile.
We do. So, and then we add on, background checks. We hire agencies that do the background checks, the drug screening, the COVID screening, and requiring, all of our employees to have vaccinations. And so, we like to think we're a cut above everybody else in that area.
So these are some, what you kind of just mentioned are some aspects that when you're seeking home care, these are some questions you should ask.
Yes, absolutely.
What are some things you should be red flags? What would be a red flag to you if you were
Well,
seeking home care?
Yeah, so a company that doesn't answer their phones or always goes to voicemail and they don't get back to you. Because that tells a lot. For example, our phones are answered on a 24-hour basis. There's always a person answering the phone. That's old school. Some people say, oh, Greg, that's old school. But no, that's what our customers want, okay? They want to talk to somebody. So that would be a red flag if you don't get that real person. Other things, how many years they've been in business. There's a lot of pop-ups now. There's a lot of franchises where people they have the money, so they buy a franchise, and all of a sudden they're in business and taking care of your loved one or the care. And so, how many years you've been in business? Have you been accredited by a national agency? Is there any accreditation out there? So, or do they have an office? I mean, we have a large home office. Well, it's like a beehive with all of our people in there, managing these cases, and nurse managers, and that's important to make sure that our customers are being taken care of. A lot of people are operating with a cell phone. That's their office. That's their means of communication, and that's about as deep as they go. So those would be other things to look out for. But if you don't mind, I'd like to add one other thing. A lot of people we hear, my friends, oh, Greg, we hired a caregiver out of the newspaper or off the internet, or, oh, yeah, we went on Craigslist and, we found, a caregiver that's willing to come right out to our house. And I'm thinking, I'll bet you they want to come right out to your house, possibly to, rip you off, and that would be probably the best case scenario compared to other things that could happen in your home. So, I don't really think it's a wise option unless you know that person. If you knew somebody from your church or synagogue, that's a different story. But to hire off the internet or out of a newspaper by placing an ad and trying to do it yourself, there's a lot of people that are looking for those kinds of scenarios to go work for somebody that is not an agency or a company like ours, because we do the vetting.
Right.
Most people don't know how to do the vetting that we do.
You guys have already done all the hard work.
Yes.
So they can have peace of mind that their loved one's taken care of.
That's correct.
Okay. Well, Greg, thank you so much for joining us today. You've given us so much information about home care. I feel like I'm ready and equipped. I can send my parents knowing that they're going to be okay when they come out of the hospital. So thank you for your time, and thank you for everything.
You're very welcome, and it's been a joy coming on the show and talking to people in the community and on tips. And if anybody has any questions, there's some slides on the screen. They can certainly get a hold of me or someone in our company. So thank you very much, Maggie.
Thank you for having me. Thank you. That concludes our show today on Boomer Health at Home. Again, I'm your host, Maggie Jess. Please, if you have any questions about today's episode or any other episodes we've ever done, please call 248-288-2270. Stay healthy and safe.
Hi, my name is Greg Jamian, and you've been watching Boomer Health at Home, powered by over 40 years of home health care experience and knowledge, along with our program sponsor, AmeriCare Medical. And please, don't forget to like us if you enjoyed our show.